The first opportunity we will explore enables you to seamlessly integrate learners into your practice setting by allowing the student to help you document in the electronic health record. The Centers for Medicare and Medicaid Services issued a rule change on January 1st, 2018, which now allows the teaching physician to verify in the medical record any student documentation of components of the evaluation and management services, rather than redocumenting the work. Keeping in mind that the teaching physician must verify in the medical record all student documentations or findings, including history, physical exam, and medical decision-making. And the teaching physician must personally perform or re-perform a physical exam and the medical decision-making activities of the service being billed. The burden of redocumenting these activities is now unnecessary. Once you've completed the activities of the patient encounter, your documentation can be limited to verifying the student's note or making any corrections to the student's documentation. In addition to letting medical students help decrease some of your computer-based activities, allowing students to document in the medical record fulfills two of the core entrustable professional activities for entering residency. Document clinical encounters in the medical record and discuss and enter orders and prescriptions. If students are documenting in the medical record when observing you with the patient, they can listen to your history-taking skills, experience your thinking out loud, and this allows them a snapshot of your expert interactions and processes. You can improve your teaching efficiency by assigning a role for the student, a role related to both the computer and the patient encounter. You may choose to observe the student taking the history while you document and then perform the physical exam together, documenting as you go. Alternatively, you may choose to let the student document your history-taking and physical exam, allowing the student to experience any unique physical exam findings for himself, and then, together with the patient, discuss and document the medical decision-making aspects of the case. In these two scenarios, you have the opportunity to directly observe the patient interacting with the student, while completing the documentation simultaneously. A third option is to have the student independently evaluate your patient and document the encounter, then discuss the case and review the note with you. After this, you complete the encounter by verifying the student's history and physical exam, discussing the medical decision-making components, and verifying the student's note in your chart. Let's put this into action and see how it works. Mrs. Jones, I'm Dr. McMurtry. So nice to meet you, and thank you for letting us take care of you today. Can you tell me a little bit about your symptoms? What's been going on?
Well, I've been having pain with urinating for the last 2 days. I'm urinating more frequently. Every time I go to the bathroom, I'm having pain. I'm going to the bathroom almost every hour now.
Goodness, that sounds miserable. Yeah. Are you having any other symptoms with it? Anything else you've noticed?
Well, I haven't felt sick, like throwing up, or I haven't had a fever.
Okay. And have you had any back pain or noticed any blood in your urine?
No.
All right. Have you been using any medicines to treat your symptoms?
I tried some ibuprofen, but it really hasn't made a difference.
And has this ever happened to you before?
Yes, about 15 years ago after my daughter was born. They told me then it was a UTI and treated it with antibiotics, but I haven't had this since.
Okay. So I think we should probably get a urine sample collected. I'm going to let student Dr. Wilson take you out and instruct you on how to collect a good clean sample for us. We can send that to the lab for testing and see whether or not a urinary tract infection is the problem again this time.
Thank you.
You're welcome. All right, Ms. Jones, will you come with me?